Hi there, everyone. My name is Amanda Purcell. I'm with the Media Relations Department of the Saskatchewan Health Authority. I would ask if you guys can hear me, but I'm not sure if you're able to indicate that right now. So I'm hoping for the best today. We are having a few technical issues, but we will work through them as we go. I'll be your moderator for today's availability. And speaking today, we'll have Sheila Anderson, who is our SHA COVID vaccine lead. And also Dr. Julie Krzyzanowski, the Deputy Chief Medical Health Officer for the Saskatchewan with the Ministry of Health. Sheila will be here to answer your questions as they pertain to the SHA's role in setting up clinics and the vaccination process, while Dr. Krzyzanowski can answer your questions on provincial acquisition, distribution, and allocation of the vaccine. So we're going to kick things off with some opening remarks from Dr. Krzyzanowski and Sheila, and then we're going to have about 20 minutes to take questions from media, and we will have some instructions for that just following the opening remarks. And that should give us just enough time for everyone for about one question and one follow-up. So we're going to begin with Dr. Krzyzanowski. Please go ahead whenever you're ready.
Thank you, Amanda, and good afternoon, everyone. I'm Julie Krzyzanowski, the Deputy Chief Medical Health Officer for Saskatchewan with the Ministry of Health. And I'd like to start by saying today that while we've been able to offer safe and effective vaccines to children 5 years and older since November, there's really been a significant number of our very youngest population here in the province that has been unable to access vaccines until now. Fortunately, the majority of children with COVID-19 have mild or asymptomatic disease, but some children, even those previously healthy, can get severe disease and require hospitalization. In addition, children who have had COVID-19 disease are at risk of multi-system inflammatory system in children, or MISC, and post-COVID condition, and vaccination does protect against these serious outcomes. I'm very pleased that today we can now extend that protection to more members of our family. I encourage all parents of children under 5 to consider the COVID vaccine for their children, and I encourage everyone, regardless of their age, to get up to date with their COVID vaccines. I'll turn now to my colleague in the SHA, Sheila Anderson, to make some additional remarks today.
Thanks, Julie and Amanda. Good afternoon. My name is Sheila Anderson, the Operational Vaccine Lead for the Saskatchewan Health Authority. I'll echo Dr. Krzyzanowski's comments. I'm very happy to announce that the SHA will be able to start vaccinating children 6 months to 5 years of age with the recently approved COVID-19 vaccine for this age group. I know many parents have been waiting to hear this great news. I want to acknowledge the hard work SHA employees have put in for every phase of the COVID-19 vaccine delivery since the pandemic began. Their dedication and commitment makes this possible. It is that success that today allows us to be ready and able to stand up clinics and provide vaccine for these youngest children without delay. Having learned the lessons and developed procedures to operationalize our response within the existing public health system. This day is a special one for me, and it's been a long time coming. It marks yet another milestone for the SHA and the province in knowing we can now help more Saskatchewan residents protect themselves and family members from COVID-19. Before I pass it back to you, Amanda, I'm just going to go over some of the details of this youngest age group campaign here. So Saskatchewan will receive a limited number of vaccine doses in the first delivery, a total of 13,000 doses for this age group. The vaccine will be offered to all children ages 6 months to 5 years, with a priority given in this age group to children who are moderately to severely immunocompromised. Starting at 8:45 Thursday, July 21st, so that's tomorrow, parents and guardians of eligible immunocompromised children will be able to book appointments for their children by calling our SASFAX number. That's 1-833 SASFAX. If there are other children 6 months to 5 years of age in this household, appointments will also be booked for those children at that time. Clinics will start across the province in select sites as early as Friday, July 22nd. On Friday, July 22nd at 8:45, then parents and guardians of all children aged 6 months and up, aged 6 months to 5 years will be able to book an appointment by also calling the SASFAX as well as using our online booking system that would open at 8 a.m. tomorrow morning or Friday morning. These clinics will start administering vaccine on Friday or later. Vaccines will be arriving in the province on Thursday to our larger centers across the province, and vaccines will begin in a staged approach as they're distributed across the province. Clinics will be set up as soon as the vaccines are received, and our goal is to make the vaccine accessible as possible with the limited number of doses we have on hand. We have about 50 sites across the province that will be offering the vaccine. We'll be offering in a blended model as we have in the past with walk-in and booked appointments, and also offering the COVID-19 vaccine and our regularly scheduled childhood vaccine appointments. We encourage everyone to seek out clinics as close to home as possible to get vaccinated, and we encourage everyone who's able to receive a vaccine to do so. We'll have vaccine on hand for all age groups. Just a reminder, parents or legal guardians are required to attend the COVID-19 clinic in person to provide a verbal informed consent for their child receiving immunization. If the parent, however, chooses an adult designate like a grandparent or an auntie, etc., to accompany the child for the vaccine, a consent form signed by the parent and guardian must be presented, and the COVID consent form can be found on the SASC website. Also want to let everybody know that we have experienced immunizers at all of our clinics who are there to help make sure that there's a positive experience for these little ones as well as their family members. We have trained professionals there to answer all of your questions, encourage parents to talk to their children about vaccines and their fears, and certainly encourage you also to bring comfort items if you so choose for your child as they're getting vaccinated as well too. And there are additional online resources to help with parents who want some more advice around getting these young ones vaccinated. Thanks, Amanda. Back over to you.
Excellent. Thanks, Sheila, and thanks, Dr. Krajzanowski. So we're going to move into the Q&A portion of the availability. Just to give you guys a little bit of an idea, there has been a glitch in the registration process, and so unfortunately I'm not able to see any names or anything like that of the call-in users. I'm only able to see the first part of your phone number. So what I'm going to do is I'm going to call out the first part of the phone number that you might be calling from. I'm going to unmute your line and then ask if you have any questions for either of our panelists. I'm going to start, I'm going to unmute for the first part of the phone number is 361. So I've unmuted that line. Sorry, I have not. Just one moment as we work through this. Okay. Yep. 361. Can you identify yourself and you can go ahead with any question you might have.
Hi, this is Montana Getty from Global Saskatoon. I'm just wondering what you think the demand is for these vaccines and how many do you think will be used up and how quick?
As I said, there's a limited number of vaccines that are coming into the province, so 13,000. And if we looked at the uptake of our vaccine in our 5 years to 12-year-old group, it's just over 40%. So this age group has about just over 70,000 in its age group, so 70,000 6 months to 4-year-olds. And so if we thought about the same uptake percentage, around the 40%, we're looking at around 35,000 doses of vaccine that we will need to meet the same coverage or uptake rate as the older children population. So we expect that this vaccine, demand for this vaccine will be high, and we may have more vaccine than the number of doses. We have been notified that we will receive a second dose of vaccine for this age group in August. However, that date has not been determined yet.
Thank you so much, Sheila. Montana, did you have another question?
Yes. So how did we end up with the 13,000? How was that number created?
I think I can speak to that. I know that Canada was limited in their overall number of vaccines that were delivered to the province and, to the country, and that Saskatchewan receives a percentage of that based on their population, I believe. And so 13,000 was the percentage that Saskatchewan receives in relation to the rest of the country with the number that came in.
Thanks so much. Okay, so we are going to move to, and I'm going to attempt again to unmute your line, but prefix 537. I'm trying desperately to unmute your line. I apologize for the technicalities today. Uh, 357. Oh, there you go. I think you're unmuted. You can go ahead. Yep. Could you identify yourself?
Yep. It's Luke from CTV Regina.
Great, thank you.
My question to you is just about the how Saskatchewan is targeting mid-August to expand the booster dose eligibility. I was just wondering, other provinces are doing it a lot sooner. I was just wondering why the target is mid-August.
I can speak to that. Currently, Saskatchewan, like other provinces and territories in Canada, are reporting increasing confirmed cases of COVID-19, and the provincial EPI report is due to be published tomorrow. That will confirm that we're seeing this trend here in the province, this wave being driven by BA5. So of course, lots of interest in what Saskatchewan is planning to do with expanding access to booster doses for older age groups. And Saskatchewan is planning and targeting mid-August for an announcement about this plan. So in the meantime, though, only 30% of those currently eligible for their booster dose have received them. And in the population age 50 and older, only again, 30% of those have received their fourth booster dose. So there is room for improvement within the province with the recommendations for booster doses that we have in place right now. We do know that these booster doses can make a difference on the impact and duration of this next wave of COVID-19. So really encourage everyone who's eligible for those third and fourth booster doses to book those appointments now. Those booster doses are being delivered at the same time that we are now introducing a new population, this youngest age group, who have not yet to date been eligible for a single vaccination against COVID-19. So to ensure that that population does have opportunity to be vaccinated, we really want this week and for the next couple of weeks to be focusing on that youngest age group and ensuring that they have the opportunity to be vaccinated. At the same time, we encourage everyone to get up to date with their recommended booster doses. But again, looking ahead to mid-August to make announcements about a decision for expanding booster dose access and fall vaccine planning.
Great. Thanks, Dr. Krajewski. Was there a follow-up question?
Yeah, just one more question. So for a lot of families, COVID did sweep through their houses. For their younger ones, if they didn't show symptoms or test positive, do they assume that they didn't have COVID and still book them on the Thursday or Friday, or do they assume that he was just asymptomatic and do they wait the 8 weeks before they book their COVID vaccine?
I'll take that one as well. I think you're asking about specific situation in a particular household. But just broadly speaking, we do know that a significant proportion, the majority of children in some seroprevalence surveys were infected with COVID-19 in these last Omicron waves. So we do understand that there are many children who have had COVID infection, may or may not have symptoms and have recovered from those infections. They are still eligible to be vaccinated against COVID-19. And it still is recommended because the evidence is showing that hybrid immunity, so when people have immune induced by both vaccines and immune from post-COVID or immunity acquired from a COVID infection, the immunity that they have is actually broader and more durable. So we do encourage parents to get their children vaccinated, even if they think their child may have had COVID-19. There's no necessary reason for them to wait. If they are confident that their child did within the last 8 weeks have a COVID infection because they tested positive for COVID on a PCR test or a rapid test, they can wait to be vaccinated. But for any other child, really recommend that they call and book a COVID vaccine appointment.
Thanks, Dr.
Thank you.
Kozlowski. Okay, we are going to go next to prefix 450. So what I'm going to do is I'm going to unmute or give you the ability to unmute your line, and then I believe you have to unmute on your end as well. So there should be a button there for you too. So if you're able to unmute your line as well, there you go.
Hi. Can you hear me?
Yes, we can.
Yeah, this is
And if you could identify yourself, please.
Yeah, this is Mickey with the Canadian Press. And sorry, can I just ask, just because I'm on the phone, I don't know which woman is speaking, if you can just say your name before you answer, then I can attribute the quote to an individual. But I just wanted to clarify, after this initial 13,000 doses that we're getting, when are we scheduled to get the next batch of doses? And are we on a regular schedule to be receiving more doses in the future?
Thanks. It's Sheila Anderson. I can answer that question. So, and I'll just a little bit of a follow-up from the last question that I answered to. So the shipment that Canada received, the initial shipment, Canada received 340,800 doses, of which Saskatchewan is getting 13,000 doses. And as I said before, with the limited dose available, it's possible that the SHA will fully administer the 13,000 doses before the next vaccine delivery comes in August. So we're expecting to get a follow-up shipment in August. Canada is expected to get 660,000 doses. And in August, we don't have the allocation for Saskatchewan yet, nor do we have the number or the exact date of delivery yet.
Great, thank you, Sheila.
Thank you. And
go ahead.
Oh yeah, as a follow-up, I was just wondering how is, I guess, the SHA going to monitor who's actually immunocompromised once they start making appointments tomorrow? And are the vaccine clinics only going to be available in Regina and Saskatoon to start?
Thank you. It's Sheila Anderson again answering. So there is an immunocompromised list of who's eligible that was posted on the Saskatchewan website that throughout the campaign, it's very similar to other age groups of immunocompromised. And so people will be asked to phone in and book for those immunocompromised individuals, children, and then those conversations will happen at the clinic level as well too. And sorry, just remind me again what your second question was.
Are the clinics starting Friday just going to be in Regina and Saskatoon, or are they going to be elsewhere in the province?
Yeah, they're going to be elsewhere as well too. So we do have some direct deliveries to Saskatoon and Regina and many other sites across the province that were expected to receive the vaccine tomorrow, so on Thursday, then we have teams at the ready to deliver vaccine on Friday. Some other sites will require a secondary distribution of that vaccine, and so they'll be, standing up clinics perhaps through the weekend and some early next week as well. But there'll certainly be more than just Saskatoon and Regina that are offering clinics. we will have a complete list of all of the clinics, and as I said before, some will be booked that you can book through SaskVax or the online system starting on Friday, and others will be walk-in. So we will have a complete list of all of the vaccine clinics through for the next week or two on the website as soon as we have confirmation of the vaccine arriving.
Excellent. Thanks, Sheila. Okay, we're going to move now to prefix 694. So I've unmuted you or given you the ability to unmute. So if you can just go ahead and unmute your line, we should be able to hear you. I can try that again. 394. Or sorry, 694. My apologies. I might be saying it wrong. 694. You are unmuted. Okay, I'm not seeing you come off mute there, so I'm just going to move ahead. I'm going to move and we'll come back to you at the end. So I'm going to go to 546. So I've unmuted your line, so you should be able to see that you can unmute your line on your end. So if you could just click the unmute button, your microphone there.
Hello.
There we go. Yeah, there we go. Who are we speaking with?
This is Tanner from 620 CKRM. I have no questions for the ladies.
Okay, great. Thank you so much. Okay, we are going to move then to 955. So I have clicked your line. So if you can go ahead and unmute.
Hi there.
Yeah, hi. Who are we speaking with?
Hi, this is Libby from 650 CKOM.
Hi, Liddy. What's your question?
I'd like to know, have there been talks about booster doses specifically for the ages 5 to 12 category? Would that be coming in August as well, or is that something that will be rolled out sooner?
I can respond to that one. Planning is underway and we are targeting August to make those announcements about eligibility for booster doses moving into the fall. So that will include which specific age groups are recommended to receive booster doses and whether or not booster doses would be recommended for people of any age who have certain medical conditions that put them at highest risk. So those are the types of planning considerations that are being looked at right now, and looking forward to August when we can make some announcements about that plan for fall.
Thanks, Dr. Krasnowski. Liddy, did you have another question?
I do, yeah. I'm wondering, because you guys said you'll have dosage of all the vaccines at these clinics, are parents going to be able to book appointments if they haven't gotten their shot at the same time as their kids?
Yeah, absolutely. We're really encouraging that anybody who's eligible will either book or on site ask if they request that they get vaccinated as well too. So that includes first, second, and booster doses for everyone who's eligible. We're really encouraging that.
Excellent. Thanks, Sheila. Okay, we are going to move over to 551. So I've unmuted you. You can go ahead and unmute on your end and you can ask your question.
Hi, this is Rhonda from CTV in Regina as well.
Great, go ahead.
I was just wondering, the locations, I know some of the smaller areas you might not know, and this might not be relevant, but in Regina and Saskatoon, do you know where these clinics will be yet? And I guess my second question would be, with this age group, you can understand there's probably going to be a lot more tears and resistance and stuff. Will there be more privacy as opposed to just being in an open warehouse, or what were the plans for that?
Thanks. It's Sheila Anderson answering the question again. So there will be, I don't have all of the sites right in front of me. Teams are still working on setting up their clinics. Some of the sites will certainly be familiar to you or to the public, where we've used sites for previous parts of the campaign already. Certainly, the public and parents and guardians who seek out COVID vaccine through child health clinics will certainly know those sites quite well. They're local public health offices, which do have, I guess, more of a private office kind of feel to them. I think we should expect there'll be a bit of a combination. Many of our very large vaccination sites have really kind of been decommissioned over these last several months as the campaign has slowed, and we'll wait for a larger probably ramp up again in August and early fall. So some of these sites will be a bit smaller and hopefully a really good setting for the children that are coming in. Typically for this age group, we have them sitting on a parent's lap and supported by a parent or guardian in that way. So as I said before, we have lots of experienced immunizers that'll be there to help really ensure there is a positive experience. No doubt we'll probably see some therapy dogs and some other very age-specific, I guess, props, etc., that will support this age group really well.
Excellent. Thanks, Sheila. Rhonda, did you have a follow-up question?
No, I think those were just the two I had. Thank you so much.
Perfect. Thanks so much. Okay, and I think we just have one more that we haven't checked in with, and that is 914. So I've just clicked on your name, and so if you can just click your unmute button and just let us know if you have a question. So that's 914.
Hey there, can you hear me?
Yeah, we can. Who are we speaking with?
This is Zach, and I'm offended you don't recognize my voice. Zach,
Zach.
No worries. Zach with the StarPhoenix here. I have a question for Dr. Krasnowski. You mentioned that you kind of gave a bit of a preview saying that we are seeing an increasing number of infections with COVID-19. I'm wondering, what can you tell us about what we're observing so far and what it might mean for the fall as people go inside and we expect maybe another seasonal rise in COVID-19?
Good question. Like I said, the provincial EPI report is scheduled to be published tomorrow, Thursday afternoon. So that data is being compiled and finalized now. But based on the data that I've been looking at, it does appear that we'll be reporting an increase in confirmed COVID cases, and that is starting to show up as an increase in hospital admissions due to active COVID infection over the last few weeks. And this is a reversing trend because in preceding months up until the summer, we had been seeing a steady decline in COVID hospital admissions. But not a surprise that we're seeing this trend in the province. It is similar to what we're seeing in other parts of the country with a wave of Omicron that is being driven really by the BA.5 sublineage. We know that Saskatchewan tends to follow what the eastern provinces are doing, usually a few weeks lag afterwards. So we expect that we'll continue to see an increase in COVID cases in the province. And it's likely that this next wave, while we don't know what this magnitude or width of the peak will be, we expect that as we move into the fall and people return back to school and to work and spend more time indoors, we may see an extended peak. So right now, I think the important message for the people of Saskatchewan is that what can make a difference in this current wave is getting up to date with your booster dose vaccinations if you haven't already done so. And as we're seeing more COVID transmission in the communities, all of the previous public health measures continue to work to prevent transmission. So if people are having respiratory symptoms, assume it may be COVID-19. You can take a rapid test, but even if that test is negative, still take all of the precautions we're recommending people take. Stay home if you're sick, continue to wear a mask when you're around people outside your household, for 10 days afterwards, and avoid contact with people who may be at high risk for severe outcomes due to COVID-19, including those who have not yet been vaccinated against COVID. So all of those measures still are what we continue to recommend to prevent COVID transmission and protect our families and loved ones.
Thanks so much, Doctor. And this next one's for yourself as well as Ms. Anderson. I'm very glad that vaccines are now available for the 6 months to 5 years category. I'd note, though, as it has already been pointed out on this call, only about half of children in the 5 to 11 category have gotten a vaccine. About 1 in 5 Saskatchewan residents, if I recall correctly, hasn't gotten their second dose of an approved COVID-19 vaccine. And only give or take half of adults have gotten their third booster dose. So clearly there's a very large segment of the population that isn't up to date on the vaccines that are currently available. I know there's been publicity campaigns, now there's been efforts to try and get those people to come onto their side of the fence, but I wanted to ask you to, what do you think we are missing here, and how optimistic are you that we're going to be able to get those folks to roll up their sleeves again?
I can start, and maybe Dr. Krasnowski wants to add to. Thanks, Zach. Yeah, I think that it's all of our responsibility to encourage and get vaccinated and encourage our loved ones, family members, friends, and others to get vaccinated and keep those conversations going and really spread the news around how important it is. I know our teams continue to work really hard with their outreach strategies. When vaccination, when demand starts to wane, our teams are out there in communities looking in neighborhoods that are have low uptake rates. I know we've talked about this before, Zach, really trying to talk to folks about the importance of getting vaccinated. And I still hear stories every day celebrating just the 1 or 2 doses of a first dose even is really really meaningful for our teams to be able to get out there and get folks vaccinated. So we are continue to try to get as much uptake as we can, but I think there's an effort that's needed by us across the province, I think, and by all of us working in healthcare and outside of healthcare to keep the conversations going and encourage people, because we know that that vaccines are a really important part of reducing the spread of COVID-19 and certainly saving lives. I'm not sure, Dr. Krasnowski, if you had other comments as well.
Thanks, Sheila. I think the piece that I would add is that we continue to see COVID transmission in the province and in other parts of Canada and around the world. We need to remember that COVID is with us, and it can be a respiratory illness that causes severe disease, hospitalizations for some parts of our population. And that is true for some people, even if they are up to date with their vaccines. So encourage everyone to consider if they themselves haven't been vaccinated against COVID, or they themselves aren't up to date with the recommended vaccines. Think about what that means, not just for themselves, but for their family, their friends, their loved ones, the entire community, the impact on the healthcare system, as a public good that we need available to all of us for whatever reason when we need it. So right now, it is time to think about those things. It's important to think about, what you need in terms of support, whether it's information or whether it's transportation or whether it's other types of supports that you need to get to a vaccine clinic, and to reach out to your local public health offices, your vaccination teams to make the arrangements that work best for you.
Great, thanks, Dr. Krasnowski. Appreciate that. So I'm just going to take one more moment for number 694, which we weren't able to connect with earlier. So I've unmuted you. If you're able to click the unmute on your end, if you did have a question, we'll just give you a second to see if we can connect with you there. Okay, it doesn't appear that we can, so I think we're going to stop there. So I want to thank both Sheila Anderson and also Dr. Julie Krasnowski today for making the time to answer questions. And of course, I want to thank the media for coming with all your questions and bearing with me today as we go through this process, and apologize again for the technical difficulties, but I think we were able to get everything handled today. We really appreciate your time. And with that, we will end today's session. Thank you everyone for coming.